Yeah, I have a question from a colleague of mine. During the technical briefing, you talked a little bit about the stress and the exhaustion on frontline COVID wards. Can you talk a little bit about that and how that impacts the ability to deal with this increase in hospitalizations?
Yeah, and I had the privilege of meeting with some of my colleagues and friends, and I talked to a lot of people who are working in our frontline hospitals around the province, as well as in public health around the province. And, contact tracing is exhausting, but it's the people who are working on the front lines in the hospital, who are seeing people come into the emergency department, families come into the emergency department, being admitted to the ward, being admitted to ICU, and then hearing things that are happening out there in the community about people not paying attention to this, not taking it seriously. And they get very discouraged. When you've been doing this day in and day out for a year and a half, it wears people down. And people are, we've got a really great team. Our critical care teams across the province are working together in a way that is supportive and amazing, but they're tired. They're tired of seeing young people coming in, and there's been a narrative out there in the last few weeks of that we're overreacting, that nobody's paying attention to this, and that is hard for people who are going to work every single day and are looking after their families, who are doing those overtime shifts and getting more and more concerned that there are people coming in and they won't be able to care for them appropriately. So it is a wake-up call to all of us that we need to do our bit as well. And that means staying home. It means making those sacrifices, small and big, every day for the next little while as we're protecting more and more people with immunization. And I've talked about this for some time, that we're in this vaccine hope, but pandemic reality, and that pandemic reality has gotten challenging and more dire in some ways in the last few weeks. But we have the ability to level things off, and we've started to see that. So that is what we need to focus on. We have vaccines that work, and they are going to get out to everybody as soon as we possibly can. But it's hard for people right now. It's hard for people when they see others flaunting things and not taking it seriously.